most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
A
Bob.
strange opinion indeed.
That's
Today
right.
we're talking about simple solutions to sacroiliac, SI for short, joint pain.
Sacroiliac. That's something my mother said when I was a child. It might be your sacroiliac. And I'm not even sure she really knew what she was referring to, but we knew it was like back pain.
I think they sit on Gilligan's Island too.
That could be where she got it. I don't know.
We actually don't have any giveaway today.
Oh,
we're
good.
always doing a giveaway every
Right.
week. And we have a one-day hiatus, and then it'll start up tomorrow. So check out our Facebook page or bobandbrad.com and go to the giveaway section.
That's right. And they'll show you there. You can sign up and have a great time. Hiatus, that reminds me of hyena.
Very good.
Yeah. Anyways, let's carry on. I just wanted to share that with people. So low back pain, the SI joint is about right here. There's one here and there's one here. We'll show you on the skeleton. Flip it around.
I'm facing just like Brad is.
So it's low in the back, below the belt line, and it's actually the pelvis here and the sacrum. So the sacroiliac, this is the ilium, so it's sacroiliac joint. It's here. It's not a joint like other joints in your body.
Pretty fixated.
It is. It's fixated with lots of heavy-duty ligaments, and you know, if you can get it to move a little bit, that might be a problem.
Right.
So that's the issue. A little movement, except for if you are pregnant and you that's when the hormones in your body loosen up those ligaments so that it can move for the birthing
And
process.
those hormones are called relaxin.
Oh, really?
Yes.
Wow, excellent. You
Yes.
did some homework.
I did.
Excellent job. So that is a joint that can cause problems. Now, as far as symptoms, if you have a SI or sacroiliac pain, typically it'll be on one side. It may be in the area of the SI joint. Oftentimes refers down to the buttock, down the leg, but typically not past the knee.
Right.
So if it's going down the leg, you might think, oh, maybe sciatica, because sciatica can go any length down the leg, but it can easily go down to the foot, but SI joint, typically not. What irritates sciatica or SI joint problems is a lot of times walking.
Right.
You're putting weight through that joint, standing, those types of weight-bearing activities.
The reason it may came up, you were going to go into this, Brad.
Go ahead.
The causes, you could step off a curb.
Right.
You could fall on your butt.
Yep.
A motor vehicle accident. You can also get, Brad, from sitting uneven for a long period of time.
Sure.
Like day after day after day.
If you're one of those people that
Yeah,
sits
like that.
like this a lot, where it puts a stress on the SI joint.
Right. Putting a stress more on one ilium than the other.
That's right. In the car accident, people say, well, what happens there is you go forward, and if your knees go into the dashboard, that'll put stress directly on that SI joint.
Makes sense.
Yeah. I had one, I remember clearly, she was about a 40-year-old woman, and she had that from a car accident. And traction actually helped her. It was really
interesting.
Yeah, it was a fun one to work with. She did very well. So let's see. Other things that we want to talk about? No, that pretty much covers it. Yep. Oh, we want to talk about treatment.
Treatment, right. That's what you came to this video for.
We're going to go over 3 treatments. Now, SI treatment, in the therapy world, you can probably go to 4 or 5 different courses and learn 4 or 5 different treatments. Some of them overlap, some are different. And it's amazing. It's not like one's good and one's bad.
Right.
It's how you approach it and treat it. So
now we should warn you, we don't know what type of SI problem you have.
Right.
Sometimes it's too loose.
Right.
Sometimes it's too tight. So we're going to have you try these things.
Right.
If they hurt, you just don't do them.
Right. You follow the symptoms. Sometimes one may be rotated there. Mutated, and there's all these different terms that we don't need to bore you with.
Right.
But so there's different reasons that your SI
kind
might
of locked
hurt.
in place. Other times, again, after a pregnancy, it's too loose.
Right.
It's moving too much.
So what we've done here, the first option we're going to give you is from a physical therapist. She's a doctor of physical therapy. She's very well-spoken and well-read. We did a podcast with her.
Yes.
Here's a book she has written for people with SI problems for the layperson. So if you have problems after this video...
Want to mention her name?
Yeah, oh, yeah, please do.
Deborah Riczo.
Yes. Yeah.
Riczo.
Yep. And we do have this in our
Well,
website.
the link below, yeah.
And it's not real expensive. It's a really good referral book. So the exercise, because I've got a history of SI problems, and I usually find out a way, and I've got 3 or 4 different ways that work really well for me, I've discovered. And we'll get to that in a little
We'll
bit.
do those later.
The one that exercise that she has a protocol of exercises, but one of the exercises in particular I'm going to show you that
I
really
believe
helped
it's
me.
her first one, isn't she? The one she starts with?
I believe so. And there's a specific way she does it. And another reason I want to bring it up is she says almost always you only do it this specific way.
Right.
Because that's the way she's had the greatest amount of success, and she's worked with a ton of SI patients.
Right.
So she says, lie on your back on the floor. Carpeted floor is probably better, a little more comfortable. Your right foot goes down, and you're going to push through your right heel down into the floor.
No matter which side the pain is on,
Yes.
you put the right foot down.
Exactly, which was surprising to both Bob
Right,
and I.
it was.
But she's the expert. This hand goes against this knee. You're going to lay down like this, and what I'm going to do is push down with that heel into the floor at the same time I push this knee.
Pushing down with this kney.
Yeah, pushing
Okay,
down
down,
that way
yeah,
with this
sure.
knee, heel into the floor, not your toes. She said the heel. Push here, and just push
So
at first.
basically, they're going like this. They're
Yep.
spreading apart almost.
Yes.
This one's going
That's
that way.
going
This one's going that way.
Right. So the ground stops that foot on the heel. The palm stops this knee. And as you feel better with it, you can go up to here. Now, the first time you do it, she's recommending 3 sets of 5.
Sure.
And you're going to want to go up to
You
3
hold
sets
for
of
how
10.
long?
Just for a few seconds.
Oh, sure.
Yep.
Okay.
Let me see here.
3 sets of 5,
Yep. I wrote that down.
2 times a day.
Yeah, and it can go up to 3 sets a day once you find out it's being it's feeling better.
Sure.
And 3 sets of 10
Sure.
per day. So that one
That
actually
would be 30.
feels pretty good right now, actually.
Oh, wonderful.
Not that it was really bothering me, but it certainly didn't irritate it.
Sure.
All right.
Again, we're looking for that fact. Does it bother you? Don't do it.
Right. And it's just moderate pressure. You're not pushing as hard as you possibly
Sure.
can. Just that moderate pressure. The next one, we want to refer to another expert in the field, and we're talking about Steve August.
Yes.
He's-
Just did a podcast. I've done 2 podcasts with
Right.
him.
And he's a doctor of physical therapy
Yes,
from New
from
Zealand.
New Zealand,
And
yes.
those New Zealand PTs, they
They
know
are
what
good
they're doing.
PTs. Yes.
They are.
They really are.
Yeah, they really do a lot of
Manual therapy.
therapy.
Yes. It means
Exactly.
hands-on. They actually do manipulation,
Right.
mobilization.
Sometimes chiropractors get mad at them
Yeah,
for doing
that's
that.
right.
But that's all right. It's all good.
He said in their country they all get along.
Yeah, well, yeah, that's good. Maybe we should move there. I
Mm. Yeah.
thought about visiting there someday. So the back pod is what he has invented. It's for a number of different treatments, but when you use it for sacroiliac pain, it's a very simple way to treat it. There's a specific diet or design to this that works really well for treating upper back, mid back, or
Costochondritis.
costochondritis, mid back, and this is for
Yeah.
the sacrum.
Yeah.
So this is going to go right here, right in the
Right
middle.
on the sacrum.
Exactly, right on that bony part. And we're just going to lie on there for 2 to 3 minutes. It's a really easy treatment.
Yes, it is. And again, should not be painful.
Right.
It you might feel a little discomfort.
Right.
But it should not sting.
Right. Or if it initially
pain.
hurts, you feel it dissipate.
Right,
and it goes
right.
away.
It feels so good. Hurts so
Yes. Should I show them how to do this?
good. I would recommend that, Brad.
So I'm putting it right there, right on that bone, right in the middle, below the belt line. And
Yeah, what's nice about this is the simplicity of the exercise.
Yeah. Now, I've thought, is there some way to get something else that you could use so you don't have to buy one of these? And I don't know if you can because it's a specific
It
size.
really is a specific size and feeling.
Yeah.
And he kind of got lucky on that. Had a brother-in-law design it, I believe, and just hit a home run the first time he did it. So,
Yeah, well, yeah, that is amazing. I mean, for me right now, this feels like good pressure on my sacrum. So again, 2 to 3 minutes there, and that can be done 2 to 3 times per day.
Again, that is not going to feel good on you if you have a kind of a loose ligamented,
Right.
the sacrum is moving too much.
Yeah, if it's lax. And this is another thing where it's not going to fix it in 1 or 2 treatments.
Right,
You're going to have
right.
to use it over a period of weeks
Yes,
to get it
exactly.
to loosen up. But he has, along with his back pod, he's got a really nice book and all the other ailments that you can use the back pod for. It's well written for the layperson. I really like it.
Yeah, it's good for posture overall.
Yeah.
So
Now, the last thing, I just want to go through the 3 things that work really well for me. One thing I found out with mine, I'd sit down after a walk or running. If I sat on a concrete step right outside my house and I put all my weight on one of my ischial tuberosities and I pulled down, it hurt. And it's like, well, that's got to be my SI because that's the only thing that's changing. So that's not one of my treatments. That just helped me zero in. I knew it was SI problem.
Sure.
But if I go to a stool or actually outside, I do it on a step, a tall step. It's actually my part of the lawn curb. And I go like this, and I push down here. And actually, right now, this feels, it just feels good. And it always feels good when I do it
So you
on
would
my
put
right
the
side.
leg up that you're painful on the right side.
Right, the right
Okay.
side hurts. I do this, so it's putting a little rotational force
Sure.
on that
Makes sense.
on that ilium. And if it feels good while you're doing it, and then after you walk around, you know it's a good exercise. If it hurts while you're doing it, or if it feels good while you're doing it and you walk around and it hurts afterwards, it needs to feel good while
Right.
and
And
afterwards.
after, yes.
Yeah. Okay, the next thing that works well is a simple lying down like this, and I'll grab here, and I push my knee out that way. I hold here. It's called a muscle energy technique. I usually do that one because it's a lot easier than this
Right,
one.
right.
And it works really well. But you can try this as well. So I'm going to push, hold for about 6 seconds, and then relax. Again, while you're pushing, it should feel good. It's like it's releasing the pain or getting rid of it. The next, and probably the most fun, but it
massage
does
gun.
cost a little bit. But if you have one or if you want it, you can use this for so many
Right.
muscle parts and body
So many
parts.
ailments.
Right.
Whatever ails you.
But when you use this on your SI joint, you have to have the head that's the air cushion.
Right.
There's
All the massage guns come with 5 heads.
Yep.
And this one is the air head, which is the most gentle, I would
It
say.
is, and you need that because there is no muscle over your SI.
Right.
It's just some
Bony.
skin and little soft tissue, ligaments, and if you use a plastic head, it's going to cause pain and problems. But you can just work that on there, and I'll work that around that SI joint, and it's just one of those things that it feels great, gets it loosened up. You can do this and then do one of the other
Sure.
treatments to mobilize it. And wow, I could do this for another 5 minutes, Bob, but we got to finish the video.
No, I think people are going to be glad that you're coming to an end. Good advice, Brad. I think these are some good techniques. Hopefully one of them will work for you.
Yep, absolutely. There's nothing better than a pain-free SI.
That's what I always say.